Well, recently, as I said, I received this flyer in the mail by my front door with the title Facts Not Fear, about pointing out issues with COVID-19, about things not being reported. So this morning, I want to bring in Dr. Isaac Bogosh to go through each point on the flyer to separate fact from fiction. Good morning to you, sir.
Good morning.
All right, we've got a lot to get through, so let's jump right in. The very first point says that 99% of people recover from COVID-19, and the risk of death from COVID for the general healthy population of school and working age is comparable to a daily car ride to work. What do you say to that?
Unfortunately, with misinformation, you put in some partial truths that give it a little bit of credibility. But of course, we know that with this infection, if we look at everyone who's infected, there's probably anywhere from about a 0.3 to a 0.5% mortality rate. And you think, well, that's really small, 0.3 to 0.5% mortality rate. When you factor that in across 38 million Canadians, that's over 150,000 dead Canadians. Like, that's just unacceptably high. So, I mean, yeah, of course, but more than 99% of people live. But even if the mortality rate is lower than that, that's a lot of death. And we're at 18,000 dead in Canada, and that's way too many. So there are some partial truths that more 99% of people survive, but there's more to this than surviving and dying. If you do survive, you can have some chronic issues after. And even with that small percentage that do succumb to this illness, that's still way too many Canadians.
All right, let's jump to the second point. Most people diagnosed have no or very mild symptoms. What do you say to that?
Again, there's some partial truths to that. We know that most people who get this infection will luckily recover in the comfort of their own home, and many will make a full recovery. But you don't have to look too far to see our hospital systems filling up and sadly, a growing death toll related to COVID-19 in the country. Like, our healthcare systems from coast to coast are stretched beyond capacity in many, many, many settings, and it's all related to COVID-19. So, yes, of course, some people recover and do well, but we know that if you're over the age of 60, the risk of having a severe infection that lands you in hospital goes up dramatically.
All right, the third point, the COVID PCR test is notoriously unreliable.
No, it's actually it's a remarkably good test, and it's the mainstay of testing. It's a very, very sensitive test. Now, like anything else, you need smart people who know what they're doing to set up the test and run the test, and you need smart people who know what they're doing to interpret the results of the test. You have to put it in the appropriate clinical context, but the test itself, if it's used appropriately, is like the mainstay, and it's fantastic. And for non-COVID-19 related infections, we use this test all the time as well. It's revolutionized medicine.
All right, the fourth point, doctor, legal action is being taken against the WHO for fraud and gross medical negligence.
I mean, I don't know what to say about this. Like, what legal action and by who and for what? I mean, this is just bonkers and out of left field. It's like, sometimes you have to shrug your shoulders. It's like, who's writing this crap?
Well, let's keep going, then I'll tell you. The fifth point is lockdowns are unnecessary and harmful to health.
Yeah, I mean, that's a really good point in the sense that we know that lockdowns certainly have some negative consequences to them. We know there's a tremendous economic toll, a tremendous psychological toll, a tremendous health toll. But of course, and quite frankly, the whole goal is to avoid lockdowns in the first place. If you can take measures to keep the numbers low, you can avoid lockdowns, hopefully, with good policy in the first place. But when your case numbers are skyrocketing and your healthcare system is stretched beyond capacity, lockdowns have been shown time and time and time again to reduce the number of contacts that people have, reduce the amount of infections that results in a community setting, drop those cases down, and relieve pressure from the healthcare system. And there's just a list longer than my arm of places that have done this successfully. It's not ideal, but it actually works.
Doctor, we got about 30 seconds to get through the last two. Wearing a face mask is unnecessary and unhealthy.
It's garbage. Face masks help, especially in indoor settings. I think we have to think before COVID-19, people who worked in an operating room have been wearing face masks for all day, most of the day, for a century now, and they're doing just fine, and they'll continue to do it. We'll just wear it during the course of this pandemic, and we'll continue to do fine as well.
The final point on the flyer is boosting natural immunity is being deliberately ignored.
Yeah, I mean, anytime you see something that's supposed to boost your natural immunity, a big red flag should go up. The best thing you can do to boost your natural immunity is to get a good night's sleep, eat a balanced diet, and get some exercise. But anything above and beyond that is, you got to be very careful about what you're reading there.
So, doctor, I think what you're saying is should be, there we go, and we're done. Doctor, thank you so much. I appreciate it.
My pleasure. Have a great day.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.